What are some of the crucial factors that fuel the high rates of child mortality in our urban slums?
Yes, as you quite rightly said, 54% of communities are now living in urban areas, and this is going to increase to about 66% by 2050. And definitely in urban communities, you have a proportion of those population actually living in slums. And there are many issues living in slums, many inequalities, especially things like overcrowding, poverty, more transmission of illnesses because people are living so close to each other, and as well, quite really poor nutrition.
How does South Africa fare compared to other countries in the world right now, Sue?
Well, in the State of the World Mothers Report for 2015, South Africa doesn't feature a lot in the report. The main way that South Africa features is in the Mothers Index, and the Mothers Index looked at 5 factors. So if we look at maternal mortality, the risk of actually a lifetime risk of dying from a maternal problem. We look at the under 5 child mortality, we look at education status, economic status, and also political status. Those indicators grouped together actually rank South Africa as 72. So South Africa is actually doing a lot better than it was last year and in the previous year's report.
Yes, and that's exactly it, isn't it, Sue? There was a drop from 72 to 75th from 179 nations. But of course, there's much more work to be done. But this is indeed commendable. If you take into account our current economic climate and the legacy of a deeply divided past that produced a very unequal society we have now, there were crucial successes if you look at it. The implementation of the PMTCT program in South Africa,
yes,
which led to a big decline in mother-to-child HIV transmission. Then there was the re-engineering of the primary healthcare model for children and pregnant mothers. That's had quite an impact in terms of immunization and nutrition. And to take it a bit further, we do have one of the largest ARV programs on the globe with nearly 2 million people on treatment. So there has been significant progress, and that should not be undermined. You'll agree?
Yes, I definitely agree. I mean, if you look at maternal mortality and under 5 child mortality over the last 2 or 3 years, it is definitely improving. Unfortunately, South Africa is not going to reach the Millennium Development Goal targets, but at the moment, I mean, we've just had a recent UN summit, which was looking at the global strategy for the Sustainable Development Goals, and South Africa, is definitely signing up to this so that we can be then addressing some of these issues that weren't addressed in the MDGs in the forthcoming Sustainable Development Goals. But as well as that, as you say, many things have improved. There are some very good policies and programs within South Africa. I think one of the issues is when it comes to actually implementing those programs at district and local level, and this is where the country really does need to strengthen its healthcare system, actually provide much more resource into human resource, strengthen the clinic facilities, strengthen the outreach facilities.
Sue, where are the best and worst places to be a mum on the globe right now?
Well, the best places tend to be in Northern Europe. So we have Norway and Finland right at the top of the scale, and right at the bottom of the scale we have Somalia and DRC.
At the bottom of the scale?
Yes, at the bottom. So Somalia being 179 and DRC being 178. If you look at the top 10 countries, all of which are in Europe, I mean, you will see, the problems have been addressed by heavy investment in the healthcare system. If you look at the bottom 10 countries, the issues that you'll see, 9 of those 11 countries which actually form within the bottom 10 are conflict areas, such as Somalia, DRC, very, very kind of unstable countries. So that access to healthcare and resources is really a big problem.
Well, Burundi's Catholic Church has threatened